Good morning to everyone joining us from the Nordics, and good afternoon to those of you that are joining us from Asia. I'd like to welcome you all to this launch event for our report on health tech opportunities in the Asia-Pacific region. My name is Paul Kastman, and I'm the Director of Innovation Norway in Singapore. I'm presently also the Chairman of the Nordic Innovation House here in Singapore. And with me today, I have my good colleagues Ida Stjernström from Business Sweden, as well as Nicholas Song from Business Sweden, and Eero Toivonen from Business Finland and Australia. And we will hear from them shortly. Earlier this year, our organizations entered into a strategic partnership. 3 strategic initiatives were to be explored as part of this new collaboration, 2 of which are located in our region. The first initiative, however, is located in the Nordics. It's headed by Business Sweden and is looking at our Nordic battery ecosystems and how we can take a larger share in a rapidly growing battery market. The second initiative is headed by Business Finland. It's also located in our region and is related to the planned construction of a new capital city in Indonesia, which would possibly represent significant opportunities for Nordic companies within smart and sustainable infrastructure, building technologies, logistics, and so on. Then there is the third initiative, which is headed by Innovation Norway, which is focusing on the healthcare opportunities in Southeast Asia. For both initiatives in our region, a comprehensive mapping of stakeholders and opportunities have been conducted. And the healthcare report that we will present today is a result of that work. When we decided to do the report, that was a natural next step following all the other work that we've done together in Singapore and also in other countries. Over the past 3 years, we've run the Nordic Innovation House project together here in Singapore, and we've organized many market entry programs together for Nordic companies within circular economy, smart city, and healthcare. To leverage on the Nordic brand has been very useful and has allowed us to get critical mass in segments where we might not have had this individually. And for us, it has been a natural step to look at the health tech opportunities in the region at large. After all, Singapore is, by all intents and purposes, the hub of the region. In addition to the presentation of the report findings, which will be done by Ida and Nicholas, we will also hear from our Nordic companies that will share some of their experiences from operating across the region, what have been important lessons learned for them and success criteria for them in the region. And with that, we will have a closer look at the report findings. So Ida and Nicholas, if you please.
They have a highly educated workforce, and they have a very strong system with links between drug developers, but also academia and the government. So these markets see a growing clinical trial landscape as well. These markets also have a smaller population, which makes health coverage in general a little bit easier to manage. But they are struggling with a very growing population. Then for Malaysia and Thailand, they have a similar level of healthcare spend per capita. So these markets have already established universal healthcare, but it's relatively new. So Thailand just implemented this in the early 2000s. So the aging population and the growth of chronic diseases that these markets are experiencing is really putting high pressure on their healthcare industries because and the universal healthcare scheme because it's relatively young. Malaysia and Thailand is also significant for their medical tourism destination, and they have a very strong private hospital sector growth. We observe the lowest level of public health spend per capita in Vietnam, Indonesia, and India. So these markets have not reached universal healthcare coverage, and they do struggle with inequalities when it comes to distribution and provision of healthcare, especially in rural but also in urban areas. They struggle with affordability issues and regulatory challenges. They have a large and young population size, which also makes the healthcare administration a little bit more challenging to handle. So looking into the healthcare industry size, Australia and India, looking at the total market sizes, are the largest markets. They also have the highest forecasted growth rates in private healthcare, but healthcare expenditure per capita in most markets in the region is below 5% of GDP. So if you compare that to OECD average, it's about 9.5%. So despite the increase in spending in recent years, healthcare expenditure is still way below OECD average. And this is, of course, signifying the intense growth that we are expecting in the coming 5 years in most of these markets, both in the public sector, but also in the private sector. So changes, including more urbanized lifestyles and increasingly aging population, have led to a rise in chronic diseases. So now this accounts approximately for 70% of the disease burden in the region. So also fast approaching the levels of the OECD countries, which is at about 80%. So of course, the chronic diseases will increase the demand for access to healthcare in these countries. Based on the World Health Organization's prediction, cancer treatment in markets in Asia will or has surpassed about $150 billion in 2020, which is a 40% increase since 2015. So, of course, this is stemming from unhealthy lifestyles and decreasing physical activity, increasing stress, and intake of saturated fats, especially, and tobacco. So, hypertension is very prevalent in Indonesia and Malaysia, tops the list with the highest prevalence rates in the region. Looking at diabetes, we see really high prevalence numbers in Malaysia and Singapore. And as well for cancer, Singapore and Australia stands out in terms of prevalence per population size. And this is expected to see increased growth over the coming years. Many of the countries that we study have an increased spending on healthcare and increased chronic diseases, but a lot of the countries are struggling with an underdeveloped healthcare system. So the region has a chronic shortage of medical personnel. Compared to the average in OECD countries, especially when you look at hospital beds. So in the average in OECD countries is roughly 5 hospital beds per 1,000 people. Whereas in these markets we study, we see that it's between 0.5 to 2.5 beds per 1,000 people. So a lot lower. Of course, Australia stands out here with some of the highest rates in the globally, whereas India and Indonesia is really struggling with availability of healthcare services and facilities. So as for hospital infrastructure in most Southeast Asia markets, in India, it's very uneven and it's very concentrated in tier 1 cities. So of course, there's a lot of room for geographical expansion. So when the healthcare markets are now starting to mature in tier 1 cities, see that providers and investors are shifting the focus to address unmet needs for patients in a little bit smaller but also fast growing tier 2 and tier 3 cities. And as you can see here, Australia, Singapore, and Malaysia, they have reached a universal healthcare coverage, whereas Vietnam, Indonesia, and India is not yet there. And private insurance coverage is the highest in Singapore here. Australia is also quite high, but then we see very low low numbers for the rest of the markets. All right, so that was a quick overlook of the economic landscape and the healthcare industry. So if we dive a little bit more into the medtech industry, we can see that the growing demand for healthcare services, also, medical devices play obviously a key role in this, and Asia Pacific is experiencing a strong growth in demand for medical devices in the light of this. So growth rates in the coming 5 years is forecasted to 6 to 7% or higher for most of the countries, expecting to be a total market to surpass Europe as the second largest market globally. So of course the region differs. So mature markets with high penetration is found in Singapore and Australia, while emerging markets include Indonesia, Vietnam, and India with very low penetration rates. Thailand and Malaysia is lagging behind markets like Singapore in the region, but definitely catching up, with more investments being made into especially easing importation regulations and promoting FDI for medical device manufacturing locally. So currently the whole region is heavily dependent on imports, between 70 to 90% on the medical devices. So there's a lot of government initiatives to ease importation from abroad, and in some markets then even promote local manufacturing. So looking at the digital health market in Asia Pacific, we can see that currently the market in Asia Pacific is roughly worth $40 billion, and the growth of the market comes largely from increasing penetration of smartphones and smart wearables devices, and a rising adoption of mobile health services. So looking at the forecasted growth of digital health solutions, Australia, India, and Indonesia is really in the forefront of this and expected to be key markets in terms of driving growth and volume of this industry. There is a lot of government initiatives to limit healthcare costs and improve transparency that has been launched in several countries. For example, in Thailand, they use this e-procurement and e-tender processes to secure bulk medical supplies and discounted prices. And private healthcare providers is obviously seeking to reduce their costs without compromising service quality. So IT solutions will really become an increasingly essential tools to managing and coordinating and delivering quality that are cost effective in healthcare. And especially hospital suppliers will face pressure to find innovative solutions to remain competitive and shift from a product-focused offering to a customer-focused, value-based and digital solution. So Nick will share with us a little bit more detailed on the study that we have conducted and what are some of the main problem statements and opportunities we observe in the various countries that we have looked at. But just to give you a short summary or a high-level overview of that, we see that there are opportunities for medtech companies in many areas of the region. So for example, if we look at research and development, medical technology is a little bit of a late bloomer in Asia Pacific. So but the region is now witnessing a rapid transformation as local companies are leveraging government preferential policies and collaborations to foster development. But of course, the maturity of this is varying in the region. So the markets that are really leading this development is Singapore and Australia, and there are three main themes that we observe that makes this possible for these markets, and would say that very successful public-private collaboration models where all the stakeholders of the value chains found a way to collaborate, government initiatives for research and development, and then a growing role of multinational R&D centers and presence of multinational companies doing R&D in these markets that kind of set the ecosystem to be ready for it. When it comes to medical devices, of course, a lot of these, or all of these countries are heavily dependent on importation of medical devices and have, as of today, not a very strong local production to supply the need. There are opportunities to export medical devices to most of these markets, and we see a very strong demand of consumables, dental, orthopedics, and imaging diagnostics. And when we look at the outlook for a regulatory environment and importation, it looks positive due to favorable government policies. However, not to take away the fact that some of these markets could be challenging, but we see that there is a lot of efforts being done to make this simpler and easier to do for suppliers abroad wanting to export into these markets. We also see that Vietnam and Malaysia are upcoming manufacturing hubs for the region with favorable FDI incentives from the governments and also a growing skilled manufacturing workforce for that to be possible. In the digital health solution space, we also see varying degrees of maturity in the region and readiness in the different markets for solutions. So an increased adoption of advanced technologies like cloud computing or Internet of Medical Things and big data by healthcare institutions, we see primarily expected short term to happen in Australia, Singapore, but also Malaysia and Thailand. These countries are currently running on an old digital health model. It's usually server-based systems that are siloed, so they're looking for digital solutions that can integrate systems and make better use of the data that they're already capturing in electronic health systems. We see that Indonesia, Malaysia, Thailand, and pockets of the market in India are really early adopters when it comes to digital health and mHealth solutions in the region. So there's a number of great examples of this with MOUs and partnerships from public stakeholders with private upcoming players, new private small startup companies in the digital health space that have had really big success in Indonesia and Malaysia, Thailand and India. And then when we look at Indonesia, Vietnam and India, we do see that the full-scale implementation of basic health information system is not fully there yet, especially when it comes to the rural areas. So I need to just set the basic health information systems and do e-procurement and those kind of digital solutions is lagging behind a little bit when it comes to adoption. So with that being said, I will hand over to my colleague Nicholas to walk through some of the markets a little bit more in detail. and go through the barriers as well. So over to you, Nick.
All right. Thank you very much, Ida. Apologies for the sound feedback. But my name again is Nicholas. I'm a consultant here in Business Sweden. So I wore the PMO hat to coordinate the activities for the research amongst the 7 markets to prepare the study. So in terms of time constraints, I'm just going to go through this few slides very quickly to ensure that we have sufficient time for the rest of us who are presenting as well. So as you can see from the matrix, we broke this down into operational efficiency and medical outcomes on the 2 axes. Based on the hypothesis, we kind of see a similar match in the economic development of these countries and the basis of the level of medical healthcare development. So I think when you see this slide, what kind of stands out is why Singapore is higher than Australia in terms of integration and optimization versus the achievement of personalized care. So we have conducted interviews on the ground, and what we understand is that the healthcare in Singapore is very controlled and regulated closely by the government. More so as in comparison to Australia. Australia allows more of the personalization, the democratization, the open tenders for healthcare providers to actually come in. But they also see some challenges in terms of integration due to the vast territories they have and the jurisdictions. For example, like Tasmania and Western Australia is very different from things that's happening in Eastern Australia. And also they're trying really hard to capture the rural population as well. Just going ahead very quickly into Malaysia and Thailand, they're really relatively similar, but private care between the 2 countries is a bit different. Firstly, Thailand have a very vast rural area and underserved population in comparison to Malaysia. Malaysia kind of sees more of these issues coming out from the eastern portion to the East Malaysia area instead of the central Malaysia, where most of us are familiar with. For the other 3 countries of India, Indonesia, and Vietnam, the state of implementation to improve their medical systems and training of their staff to operate these devices are key. A lot of these areas still lack electricity and the 5G networks or the 4G networks that are kind of what's needed to carry on a lot of their tasks. They also face issues such as hygiene, quality equipment, bids, and all this are kind of more needed in the kind of central area in comparison to things that are facing the rural area. But good news, we're seeing a lot of increased demand in Indonesia and Vietnam because of Bali and Da Nang being interesting for tourism in the near future. So moving on. Just going down straight into Singapore. I'm going to keep this brief. Singapore is a small, economic strong state, seated on a foundation built on good governance and professional trained staff. A lot of interviews kind of highlight a very common rhetoric that aging population and manpower crunch are the rooted issues of Singapore. So Singapore is kind of focusing on a strategy of 3 beyonds, beyond healthcare to health to promote active aging, preventive health and disease management. Number 2, beyond hospital to community. So this is the integration across the different providers, moving care beyond hospital to the community. And number 3, beyond quality to value, which is bringing appropriate care and efficient use of clinical resources and manpower. So on this part, what we understood also is that Singaporeans have high expectations, more so than our ASEAN counterparts, kind of similar to Australian counterparts. We tend to kind of look for second, third, fourth opinions. We look at phones for reviews. When we book our treatment, we look at the type of hotel rooms. We want to choose our food. We want to look at the view, for example. These are kind of the things that Singaporeans and a lot of our advanced economies look for. And of course, the hospitals, the healthcare providers want to really look for these kind of bespoke services for their patients. Hospitals right now also see they have their telecare in the front end is very good. You can see it. It's very people are able to access it. However, in the backlines, we've heard news that they're still using Zoom, so they're not using any proprietary technology. That's what we've heard. So these are some of the areas that we kind of see. Also, there are issues with data sharing. A lot comes down to security, cybersecurity. So, bringing across the whole ecosystem from legal, community care, elderly care, support, name it. It's kind of a bottleneck in a sense. And then finally, Singapore really kind of wants to solve. But look for ways to kind of address their manpower issues, reduce the pressure through new technology, ease the burden on hospitals, and improve the delivery of care for the whole patient journey. For Australia, demand for remote care and population health is huge. New South Wales, Victoria, and Queensland Health take up 70% of the total market share. Private players do play a large role in providing individuals who want more control in choosing their own doctors, want to have reduced waiting time, elective surgery, but are willing to do it at higher cost. So very similar where we see it with most advanced countries, or most countries per se. Australia's strategy is really now to bring healthcare to home, to the rural Australians. Indigenous Australians have a life expectancy 10 years less than non-Indigenous Australians. And a lot of it comes to being digitally excluded from the population. A lot of them still stay in the rural parts of Australia. And then, the country really wants to kind of strengthen the support for these people. This means, digitalization, consumer technology, monitoring technology, telehealth. These are some of the solutions they are looking at. They want to increase their spending in response to a lot of this kind of things that's happening right now, especially exacerbated by the COVID-19 virus. Gonna really speed this up and just going to jump ahead to Malaysia. Malaysia, major hub, big on manufacturing. They have a bit of a fragmented system. A lot of it comes to the data and service quality. In Malaysia, right now, key things are diabetes, hypertension, cardiovascular, and cancer, mostly lifestyle related. We found out from interviews, kind of key things we saw is that ambulances are not connected to any digital systems. A lot of the medical reports are still being used through email, sending a letter to the hospital to get a patient record. And startups are now, starting to just analyze digital health data to predict diseases, but it's just very new. Also came from COVID-19. So in Thailand, similar like most countries, we're seeing a very marked increase in elderly population, and their population is very flat right now. That being said, Thailand Medtech industry is heavily driven by the private sector. So 66% of hospitals, most hospitals, it's private hospitals in Thailand, and they play a key role. And what I'm trying to say here is that in order to enter the market, you gotta figure out how to enter through the private sector, because they have a lot of control. You have to have key understanding of the key opinion leaders, the key people in the family-owned businesses and stuff like that. So we really understand that the interviews, we saw online registrations are still in the infancy. There's overcrowding in hospitals because of COVID. So they have some problem. They need some updates to their CRM management systems. There is a demand for high-tech equipment such as cancer and disease diagnosis. They're looking to a lot of the rich are in, and their tourism sector, the medical tourism sector is kind of seeing market increase, and they're looking to pay for these healthcare services. So yeah, moving on to the next slide, which is Indonesia. Key things about Indonesia, so just gonna go ahead to the interviews. The interviews, what we found out is that there has been a fear of collapse from the healthcare system very recently because there's a shortage of medical professionals and immature health ecosystems and increased number of diseases, plus COVID-19. So they have seen some interest from private hospital groups creating digital roadmaps to develop clear regulation and guide to bring the medical care to the digital, bringing technology to the people, to the masses. You can also, what has been feedback is that they're looking at ways to work with e-commerce giants, such as Tokopedia, for example, to actually democratize and expand their consumable healthcare technologies to the rural areas such as Java and Sumatra. So yeah, this is one of the key things we found out. And then for Vietnam, Vietnam is growing really fast. Vietnam sees them increasing in terms of their spending to 6% a year on year instead, even though their patient growth rate is only 1% a year, and a lot of it just comes down to COVID-19 recently, but also that a lot of manufacturing has entered, or a lot of FDI has entered into Vietnam. So there needs to be a kind of concrete healthcare solution or healthcare provisioning to expats to the growing middle class. So you know, they kind of lack the skills, they lack kind of the IT required to actually implement this in the large scale right now. So we again, from the interview that we've got, Vietnam's tech giants and governments are catching up very fast to the telehealth, but the implementation has been very difficult because of low technology platform and the skill sets required. IT infrastructure for preventive health and triage is also low. They're being developed and they're looking for new solution providers as well. They also lack non-invasive diagnosis, a lot of outdated equipment and methods they're using. The medical technology sector is seeking out more advanced technology to build up its local production capabilities as well, to kind of entice more manufacturing capabilities in their area. Some of the private healthcare providers were also interviewed, and they have noted that their furniture, beds, medical equipment, human resources are kind of issues. They're also looking for support for education, build the groundwork to the medical players to build the necessary skills to actually learn or know how to use this equipment. So finally, for India, large population, as you know, India is very vast. They have both the caste system, the demographics are very different. So in terms of this, it comes down to, you know, the fragmented society. We see the division in the healthcare sector as well. They're looking to have a unified digital health infrastructure to bridge the gap across this whole journey for them. So again, through the interviews, we have found out that, you know, for going down to the primary care, the GP level, some tier 3 cities, they're using very old equipment, diagnostic devices that were purchased 10 years ago, such as old BP, old glucometer devices. We also learned that they're very highly unevenly distributed. Some doctors see 3 patients at the same time in the same room. There's no cap to the number of patients a doctor should see a day. The adoption for new technologies is also very slow, as that they do not see the key benefits from technology. So for example, the implementation of RP and IoT mostly are governmental level, but not deployed in the clinical workflow. We also saw that one large physician group actually said that a European technology provider tried to enter the market previously, but they have very high price point, and it did not fit 90% of the Indian market. as this is a mismatch with the system. So in order to enter India, one thing got to understand is that they have a very, very diverse economy and a very diverse people, and got to equate that into how to enter that market. So very quickly, we're going into kind of the barriers, and from this slide, there are many medtech opportunities. So what we did here is to really try to summarize what we've gathered into 4 areas: business scalability, market access, medtech readiness, and healthcare maturity. So the challenges we saw, there's inadequate supply of doctors and nurses, there's quality of pay, and then there's a lot of these things that we're seeing right now. And then in Singapore, it's highlighted in red. It's because of the smaller size, in scalability. A lot of Singapore is very matured already. But in Australia, again, it's very scalable to the other parts of Australia, in the rural parts of Australia, that kind of sees, and the huge population that kind of sees that potential market for you to kind of target. Things like Vietnam, for example, their healthcare maturity, like what I explained prior from the slide on Vietnam, is that again is very new, looking to expand, and it's something they can target. And if you're looking at how to target the expat, to target that kind of growing area of the middle class. Things like Indonesia and for Indonesia, for example, although they are very low at the moment, there is a very marked government kind of focus on building their healthcare capabilities. The movement of the new capital and the whole a lot of tourism entering there as well. With Bali, for example, they want to build that hub, so it could be very interesting in terms of how you want to pivot and enter the market. So finally, we want to we really believe that there are a lot of great solutions here, and there are a lot of people who want to expand into the Asian market, the APAC markets. But without understanding the local needs, the markets, you will really face a lot of legal barriers, a lot of long refactoring time. The providers will really need to think about the clinical workflow. For example, if you have a very good AI technology, you're able to gather the best information from this MRI scan, right? But are these doctors able to pass over this large file, this large terabyte of images to the clinicians, to this service provider? And if the clinicians can able to get this data and make an accurate report, or is it, is this workflow so complicated that there will be no adoption? So this kind of things has to be understood in the market, how they adopt it. Will it be will it fit the solution? Do we have the clinical trials available for you to actually enter this market? So things like that have to be understood. And what we can say is that we as Innovation Norway, we as Business Finland, and myself in Business Sweden, is that our job here is to really provide you the service to kind of understand this market. We have a long established connection with networks and industry practice experts, and we will support you on your go-to-market strategy from end to end. So thank you, and over to Ida.
Thank you so much for that presentation, Nick. That is the end of the health study presentation. I'm seeing that a lot of people in the chat is asking for access to the presentation. If you want to download and get the full version of the Nordic health study with all the research, please reach out to your respective Nordic TPO organization. You have some contact details in this material, which will be shared with everyone afterwards. So you can reach out to the contact person to actually get more information about the study. All right, so before we jump into our speakers of the day, there is one last thing that we want to do for this study, which is a poll question to the audience today. So Business Finland, Business Sweden, and Innovation Norway are looking to do a more collaborations on the health industry for Nordic medtech companies. And we want to get your inputs in terms of the value of having such a collaboration and doing a joint Nordic medtech positioning towards healthcare providers in Asia Pacific. So I will launch a poll with 3 questions for the audience to answer. So the first question that we will launch is related to the actual collaboration of doing a joint positioning of Nordic medtech solutions to providers or healthcare providers or stakeholders in Asia Pacific. So we want to gather the audience inputs in terms of how valuable you think that a joint Nordic medtech positioning would be for this region. So everyone should see a poll and you can submit your answer. Right, I think we are still waiting for some responses. Yeah, I think we have. We're still waiting for a few people. I think we'll end there. The second question that we'd like to ask to the audience is, under a joint Nordic medtech collaboration that we potentially could do, what type of support would be most relevant to your business internationalization? So market research and information, access to customers and sales support, access to partners and distributors, access to investors, market entry, expansion strategies, or regulatory environment navigation. So please submit your answer. Still waiting for a few responses. I think we have 50% responses. And the final question that we have for the audience is, based on your target market and product and solution offering, which markets in the Asia Pacific region are most interesting to your business? So we have split this up in 5 different regions. So please choose the ones that are most interesting to your business expansion in Asia Pacific. All right, that was everything. Thank you so much. And now I will hand over to our first speaker of the day. So welcome to Tahoon Park from Lardal Medical. Managing Director, ASEAN and Korea. Yes, can you hear me?
Yes, I can.
Yes, okay.
Okay, thank you, Ida, for introducing me. And And thank you for inviting me to this webinar and also giving me opportunity to share our experience in Asia Pacific. So my topic is going to be about how we can expand our business as a long-term basis based upon the diversities. And as previous presenters mentioned, that we are talking about Asia Pacific, but it's not really a single unique unified country. We have all different cultures and different we have diversities. So as introduced, my name is Tae-Hoon Park, and I'm a managing director of ASEAN and Korea. So I'm sitting in Korea now. I'm supposed to spend my time, 50% of my time in Singapore, but because of this pandemic, I'm still in Korea. So I've been in this business almost 30 years, and the work experience with leather has been 20 years by this year. Let me introduce about our company. We are based in Stavanger, Norway. This is a private family-owned company. So founder of our company is Osman S. Ledal. See the photo there. And we started our business as a toy and children's book. But when we had the 1960s, there was a time that modern so-called CPR, life-saving technique, cardiopulmonary resuscitation. So we're using mouth-to-mouth technique and chest compression. Most of you might have learned already. So since then, we got into our business, into the medical device and also the medical education solutions. Okay. Our mission and goal, this is, as I said, Norwegian company, but also very mission and value-oriented company. So if I just introduce briefly about our mission and motto of the company, our mission is to help save more lives. This is based upon, it's not only our company motto, but based upon, United Nations, Sustainability Development Goal, which is, directly related to goal number 3, which is talking about healthcare and well-being and global health. So what we have set our 2030 goal, which is helping save more lives. Actually, we have ended up to, based on our research, we have a specific number to reach, which is 1 million more lives. So you can see the details of which area we would like to help save more lives, from cardiac arrest related, death. We would like to help saving another 150,000 more lives every year by 2030. Okay, let me skip this. And our business solution is not only from the medical devices, like our business is focusing especially on the medical areas, especially in emergency medicine and also critical care and EMS side. EMS meaning that emergency medical systems of the society, which is most of the advanced country is handled by ambulance services, either public or private. And over to save those 1 million more lives, we also have been focusing on the medical error. So how to reduce medical error by providing better medical education through medical simulation technologies. And one of the strengths of our company, the other has been, it was established in 1940. What we have been successful is that not only as just a business owner of the company, but we have been working very closely with the key organizations and partners. For example, American Heart Association of the United States has been a long partner of Ledal. So we have been working together to not only develop new solutions, but also to increase the survival rate of the society. Let me then introduce our business and our market entry into ASEAN region. Although we have representatives of most of the ASEAN countries, we talk about 10 countries, as Nicholas briefly talked about each country. So we have our partners, or those 10 ASEAN countries. So, but for the purpose of this meeting, I will focus more on to the Singapore and Indonesia case. So for us, we actually we were introduced to this Asia Pacific back in 1985 in Singapore. So that's the period we decided to set up a representative office, or the liaison office, because we saw the potential. Next driver of the economic growth would be from Asia Pacific. So we decided to set up a company in Singapore, and then we set up our sales organization in early 2000. So now we have an office in Singapore, and also we do have an separate office in Malaysia. So our goal is to double our business for the next 5 years by the end of 2025. So with this, the team, and currently we have a team of 19 people. 12 of them are in Singapore, and 4 of them are in Malaysia. And we do have direct representatives in Indonesia, Vietnam, and Philippines. So the market areas we have been focusing on is actually the healthcare, the industry, but not only in the hospital side. As I briefly mentioned, that we also have been very interested in medical education segment, which is led mostly by medical schools and nursing schools and midwifery schools. And not only that, but also we have been pretty much interested in EMS, emergency medical system, service system. So in Singapore, for example, Singapore Civil Defense Force, SCDF, has been leading this ambulance service in Singapore. Malaysia, we do have St. John's ambulance services. Those are the ones that we have been working closely together. And some of the success factors in Singapore, Singapore has, as Nicholas mentioned, that Singapore has been in terms of the growth and social structure, has been really an advanced country. But the problem with Singapore is that it's a small, in terms of business opportunity. So what we have, worked in Singapore is that we try to build our relationship with the partners, not only in the medical side, but also in public and also government organizations. So these are just a quick list of the examples of those partner organizations we have been working together. So for Singapore, although the market is small, but because of the advancement in medicine and also medical education, we want to set Singapore as a reference site for other countries, or the influencer for other countries in ASEAN region. We do see some of the challenges because these days we are also interested in this digital solutions in medical education, but Singapore has very specific regulations, unique regulations in terms of data protection or data security. For example, Singapore has very unique system. So most of the European countries and Asian countries, GDPR, global data protection regulation, that has been kind of good enough as a basis. But Singapore has been using very different systems. So GDPR is not good enough. So we have to prepare the better system to satisfy the Singaporean customers. And also when you talk about for the medicine side, Singapore has been also famous to build up their own guidelines and protocols in medicine. So, for example, you might not be familiar with the details of CPR technique, but most of the countries worldwide, we are using a compression depth to be more than 5 centimeters is good enough. But Singapore is one of the, I think it's the only country who still wants to use as 4 centimeters as a guideline. So that's one of the typical example that when you deal with the Singaporean, customers and market. Okay, then let me introduce our market entry to history and our experience to Indonesia. Indonesia, as you know, Indonesia has been in terms of the population, it's the number 4 in total the size of the population. That's in one side it's a problem, but on the other side it has a great potential. And also the government is also trying to support most of the society to try to build the infrastructure. So we do see great opportunities from Indonesia. Sorry. Let me take a... Okay, for the healthcare market, this is a great opportunity. We have over 2,000, close to 3,000 hospitals, not only public but also the private segment. And not only these healthcare the hospitals, we do also have over 10,000 public health. These are all opportunities that we need to approach. And healthcare education-wise, we have a good potential in medical schools, over 1,000 medical schools and close to 300 nursing schools. These are all opportunities, and they are not quite ready at the moment, but that should be our future kind of potential for our market development. Not only those are the typical medical side, but also we have been focusing on this maternal and child health area, because Indonesia has been one of the high the maternal mortality rate, as well as the neonatal mortality rate. So one of the thing that United Nations Sustainability Development Goal, there is a government project led by Ministry of Health. They have set up some system called EMAS. So this program is actually working with the United Nations, and to meet the SDG goal number 3, they have announced a plan to reduce the mortality rate and neonatal mortality rate reduced by 25% by 2030. So this will also give us a good opportunity, because to reduce this mortality rate, you need to have a better, not only the better medical services, but also the better medical education, so that the healthcare providers and professionals need to be ready, better ready for these, to prevent this, the mortalities. EMS also government has announced to develop further in the EMS system, because in Indonesia at the moment, they don't really have any good, EMS system. So if anything happens outside of hospital, transporting the patient to the right hospital is still challenging. And so this is another area that we have been focusing on, and we do see opportunities in the future. I'll give you just a couple of success stories. To be successful in Indonesia, what we learned is that we want to not only the professional societies, but also choosing a good distributor, commercial partner working in Indonesia is also very important. So we have been lucky to have a good, high quality distributor, the commercial partner in Indonesia. And also, again, working with key partner organizations and also key medical societies is also very important. I'll give you just a couple of the photos. This is one of our solution, which is practicing childbirth. This is hybrid, so something called hybrid system. So if you look at this photo, this is a medical doctor, OB/GYN doctor in Indonesia, and the training has been conducted at the LKBK hospital, which has been the oldest and the largest OB/GYN hospital in Indonesia. So actually, the doctor is actually simulating the childbirth. So she put our mannequin on top of her belly, so they can practice how to have the baby delivered safely, more safely. Okay, and also the connection with the international, the champions and also the experts. So we have we have been supporting major societies with the key experts from internationally renowned experts, so that we connected them to the societies in Indonesia, so that they can work together, and they organize conferences and also workshops. So this has been another successful area. And another one is that we also need to work with the NGOs and international funding organizations. So there has been funding opportunities from WHOs and IMF and sometimes World Bank, JPEGO. JPEGO is Johns Hopkins not-for-profit organization organized by Johns Hopkins. So there are also available funding from these organizations. So we have been successful to identify and get the funding. It's not funding for us, it's funding for the Indonesian government so that we can work together to which type of the educational solutions they can spend with this funding. Okay, some of the challenges. Again, we need to understand culture. The understanding culture is very important. It's very different, in a way, different society. Indonesia has been the largest Islamic country. So understanding culture is very important. And also working with a partner organization is an opportunity, but also a challenge because relationship building is always challenging part. Building relationship and sometimes, being a friendly relationship is sometimes very challenging. And also the legal process and the regulatory details is also very important, especially for the medical devices and medical education solutions. So product registration is a key part for Indonesia. It takes quite a long time, and they have also introduced a system called e-catalog, which is very important for medical devices, because once you register a product to e-catalog, it's a lot easier to promote because it's open to anyone with the transparency. But registering to e-catalog is quite challenging because it's open only once or twice per year. So, and then you only got to know when it is open only a couple of weeks ago, and they open it for just 1 or 2 weeks. So you have to be familiar with this kind of a system. Okay, and for us as a leather, as a global company, I mean, just selling things is not good enough. So we also would like to build our own opportunities by working with the social network. So building infrastructure, as previous presenters mentioned, that infrastructure is not quite ready in the country like Indonesia. So we also give them confidence and trustship that we are here to help them to build the infrastructure is also very important. Okay, that's about my presentation. So thank you for paying attention and listening to my presentation.
Thank you so much, Park. I just want to mention that we are running a little bit late on the schedule, so I will have to ask the speakers to speed up a little bit so we have time for the panel questions. So we'll hand over to Ike here, and I have Shane H with me. So Shane, will you please take control over the slides?
Thank you, Ida, and thank you, Park. Enjoyed your presentation. Firstly, I'd just like to thank Innovation Norway, Business Sweden and Business Finland for the opportunity to represent iCare here today. And hopefully you'll enjoy the information that we can share. My name is Shane Hagi. I'm the Regional Director for Asia Pacific. So for us, Asia Pacific, my region is from Japan to India and down. So it is rather a large area. So who are we? Our parent company is a Finnish organisation called Revenio, and the brand that we represent in Asia Pac is iCare. So in that, we are manufacturers of ophthalmic devices. So those devices are used in ophthalmology hospitals, private clinics, optometry, primary care facilities, NGO, etc., etc. So we have products that are measuring intraocular pressure, so in the eye, which is for looking at patients who are at risk of glaucoma, and glaucoma is the loss of the peripheral vision. Then we have our retinal imaging devices, so fundus cameras, so where we're looking at the back of the eye, looking for retina disease like diabetic retinopathy, age-related macular degeneration, edemas, retina tears, etc., etc. And then we also have perimeters, which is looking at the loss of your peripheral vision, and then how fast it is progressing or regressing. Recently, we acquired an Australian software company, so now we're also starting to navigate into digital health, clinical communications, and remote patient monitoring. We are a listed organisation on the Helsinki Stock Exchange. In 2020, we had a turnover of just over 61 million. You know, as the previous presentations have shown, you know, Asia-Pac is certainly a growth area. So in the last 5 years in Asia-Pac for us, we've grown from 3 million to 12 million in that time. So, and the opportunities there to continue to grow are absolutely enormous. So the products that we have, so as I mentioned, so tonometry is where we're measuring intraocular pressure. So all of the products that we have actually in our range are unique. There is no Me Too type products here in this product portfolio. So we use a disposable probe which bounces off the cornea 6 times to measure the intraocular pressure in the eye. So if you have an elevated intraocular pressure, which is over 21, potentially you are at risk of having glaucoma. Obviously, just measuring intraocular pressure is not just the be-all and end-all to say that you have glaucoma, but it is an indicator that you are at risk. And the home device is a device that a patient can actually take home. So that's been, you know, an interesting product, especially during COVID, where a patient hasn't necessarily been able to get to their normal optometry or ophthalmic appointment. So the doctor can see the data in the cloud, real time for the patient being at home. So again, unique product. In our imaging and perimetry products, again, they are completely unique. We're one of the only companies that have scanning laser with white light LED that gives you a true colour image of the retina. And with our perimetry, traditional perimetry uses eye tracking to look at the stimuli on the actual retina. We actually use a retina tracking. So again, the degrees of difference when we're actually doing perimetry with our product is quite unique. And as I mentioned earlier, we acquired a Melbourne software company called Oculo. So again, we're looking at, you know, moving more away from being a box manufacturer to, you know, a provider of solutions in the eye healthcare market. So it is, you know, a growing need, and especially in developing countries where potentially, you know, the eye healthcare ecosystem is not the same as what it might be here in Australia or Japan. Being able to add more value to an ophthalmologist in making a diagnosis is certainly becoming more and more important. So we see, you know, the solution side of our business as a key driver in growing our business moving forward. So us as an organisation, you know, we are now fully focusing on purely on the eye healthcare market. We're looking to improve the clinical diagnosis for ophthalmologists and or optometrists. So again, providing better clinical pathways for people to follow. Our brand, you know, needs to continue to grow, especially in Asia Pacific. You know, globally, we've been in the marketplace since 2003. So we've been there for a while, but in Asia Pac, depending on the country, you know, it sort of varies from, you know, 16 years to 5 years top scenario.
Shane?
Yes.
This is Ida. I'm just going to ask you, I'll give you 3 more minutes and then we'll hand over to the other speaker. I'm trying to speed us up a little bit because we're behind schedule. Thank you.
No problems. I think one of the key things, and I think Park touched on this previously, You know, we're active in most countries in Asia Pac. The challenges for us and many organisations in the medical device space is the regulatory side of things. So each and every country has its own regulatory process, and it is challenging to navigate. But as an organisation entering into Asia Pac, if it is possible for you to ensure that you own the device registration. By owning the device registration, if you're using distribution partners within a country, if you need to change, it certainly makes it much easier to change if you need to. We have taken a view of having local people. So we have people based in India. We also have 2 people in China, 1 in Taiwan, and there's 3 of us here in Australia, all in different cities in Australia. But that certainly really allowed us to be a lot closer to the market and to be reactive and proactive with expanding our business, in the Asia Pac region. A lot of it is about having face-to-face meetings and building those relationships. It's been challenging during COVID, but we've managed and continued to grow. So hopefully that'll do for now, as we're sort of running out of time. But by all means, anybody, if they'd like to reach out to me, I'm certainly available. Thank you.
Thank you, Shane. We do have some time for questions later, so let's see if we can follow up there on some of these topics. All right, so I will hand it to our 3rd speaker of the day, which is Reidar Gårdebæk, CEO of Ortevus. So please, Reidar, do you want to take control over the slides?
So thanks. I hope you can hear me, and thanks for inviting me and presenting Ortevus and what we are doing in the APAC market. So I'm the CEO of Ortevus, and we are based in Sweden, Stockholm. We are a company on the stock exchange on Nasdaq in Stockholm. And we are having our R&D and production actually in Sweden. And we are now moving into the APAC area in our international expansion. And on this picture here, you see from one of our customers, which is in the Northern Ireland, and we are supplying them with electronic patient records for their ambulance care. And what are we then selling and doing marketing? We are doing monitoring solutions for out of hospital care. So monitoring is typically you want to have the ECG of the patients, you want to have the blood pressure, saturation, etc. So that's one of our product areas. The other one is the name EPR, which is electronic patient record. And here you have everything from patient data, and you can monitor also at the same tablets, and you can also see get information from the dispatch system, and also you can transfer the data into the hospital system. So very short then on regarding the patient monitoring. You see on the picture here, it's a tablet, and then it's connected wireless through the different sensors that you can place on the patients. And it's a modular system, and it's really low weight. And all data that you see on this tablet is also transferred in real time through the cloud, and you can visualize this in a hospital remotely, which means that you can really connect to the experts locally in real time. So you can have also video and chat functions. And this is a fully ECG diagnostic quality of the system. And the PR system can be placed on the same tablet, but of course some of our customers are using the EPR but monitoring from a different vendor and vice versa. So they can work independent of each other. And this tool is really for decision support, triage, and it also helps the paramedics what are the different measurements that you can do. And you have also like medication modules and so on. And it's intuitive and user-friendly, And this is a proven technology which has been used. We started in Sweden and are now expanding into different other countries. And it's modular, and mentioned before, it's a full real-time communication. And this really is one of the essence in the system, because we talk about e-health and being cost effective, which means that use the best technology available. So this, in summary, you could say that this is moving out advanced care to be done remotely on the site. Just to give a picture of this is that some of our customers, 40% of the different calls, they never transport the patient to the hospital. So that means 1/3 can be treated on site. So that's really saving time for the patient and the healthcare system. And you can imagine some of our customers in remote locations, they may have 2 hours drive to the closest hospital. So of course, this is a significant effectiveness driver. And we are delivering solutions for professionals, clinicians, mainly for the ambulance care, but we're also expanding into the primary care, where you have a need of doing distance monitoring. And this has actually been booming now with the pandemic, because you want to avoid having elderly sick people going into the hospital, because that's where the risk of infections from others actually increases. So currently we are active in a number of countries, and we have now installations in Norway, Sweden, Great Britain, Italy, and we have a large installations in Singapore that just went live this summer here. And we have now our equipment is used in around 2,700 vehicles, and it's increasing more on a daily basis. When we select the different markets, I mean, there are several criteria. And first of all, I mean, the structure of the ambulance care, and they need to have the right incentives really to drive efficiency. And they are usually measuring in clinical performance indicators. So we are, with our system, helping them to achieve and monitoring that they receive those indicators. The customers should have the infrastructure in place, meaning that usually it's more effective if they have a good electronic dispatch system, and also if they have modern hospital systems or national patient records, because we are connecting them to those different, so you can have a complete workflow of information, all from the dispatch into the ward or the emergency department. And then of course we analyze the competitive situation and what are the requirements they have on the system, and then looking at the different thresholds, which could be certifications, language barriers, and also the use of a local partner. I will come back to that later on here. First, the customer case we have in Singapore, where Ortobus was contracted 2 years ago, and that discussion actually started several years before that. And this was, as mentioned in another presentation here, it was actually the Singapore Civil Defence Force. They saw the challenge of the number of EMS calls they have, and they looked at the aging population, and they did a calculation. This will increase with 5% per year. So how to handle the increased number of calls, and then they decided to go out in a tender and buy a modern EPR system. And they named this EPR system the Omni, Operational Medical Networks Informatics Integrator. Then they looked at different customers, and they saw our system reference sites in UK and thought this is a system we would like to introduce. So we started then to see which local partner can we work with. And the decision was here then to work together with Singapore Telecom. We then Singapore Telecom is the one that have the customer contract, and we are subcontractors to the Singapore Telecom. And this system will be nationwide for Singapore, so serving the whole population of 4.5 million, and will be used by 1,300 frontline clinicians, and that's around 600 vehicles. And to give you a quick idea of what this looks like, there is a short movie actually developed by the customer describing this. So instead of me talking, we can have a quick look at that video.
So Radar, to play the video, you can click on the next slide, and it should work directly from there.
Okay.
Yes, you should play it from there.
I click on it, but nothing happens.
Wait, let me try to take control. All right, give us 1 second, Radar. We will play this for you.
There's no sound.
Did everyone hear it?
Nope, no sound.
There's no sound. I think we should skip the video and go on. Yeah. If you go back to the slide deck, and we can continue with the other slides. All right.
Sorry about that. We were trying to play the video, but seems like it's not working with the sound. Sorry about that, Radar. Please go ahead. Sorry, Radar, you are muted.
Sorry. Yeah. Okay, so the lessons learned from our side is, I mean, the sales process is quite long. You can imagine we started discussions 2015-16, and 4 years later, actually the installation is starting in Singapore. And then, of course, there is differences in the organizations. We, as a more small innovative company, fast moving, are working with Singapore Telecom, which has more than 20,000 employees. So of course, there is a difference in the matrix and the company. And also, our relations with our customers is really customer oriented. We can adapt and make the local integrations, which is essential for us. And we also, of course, see some culture differences. And the lessons learned here is to have a clear agreement about the content of delivery, responsibilities, and so on. Even if we spent quite a long time of that, it's quite difficult in the beginning to see what will come up later on. But actually it has been working really good, and also during the pandemic. So we are doing all the development and so on in Sweden, and we can upload and do everything digitally from Sweden into Singapore. We actually then, just 2 weeks ago also, we announced that we are moving into the Australian and New Zealand market. And we also saw that on the previous slides when we look at different countries, because based on the infrastructure and the growth and also the demand for different systems, we saw a demand in Australia here for systems that we can supply. And we did a market analysis there, and we also had interviews with different possible customers. And then we, together with Business Sweden, we made a partner evaluation. And from that, we set up one-to-one meetings with different possible partners. And during that process, then we met Trapeze, and we saw that this was actually a perfect fit for us and Trapeze here. So we have now signed a partner agreement, and Trapeze will be our local partner for Australia and New Zealand. And they are already within this area, but they are lacking an EPR and a monitoring solution. So our products actually will be an additional complement to their offering today. And the recommendations from our side here going forward is really to do a market analysis of the market, because it takes a lot of time and effort to go into market, and to make a mistake probably you don't see until several years afterwards. So we have done a thorough analysis of the markets, both when it comes to Singapore before entering that one, and also now when we go into Australia and New Zealand. And we also see that a local partner is really essential to have, and we have analyzed different partners until we selected the ones we currently have. And then, of course, after Australia, we will monitoring different countries in the APAC area. And it could be this, you could use one partner for several countries, but we say that it should be the best one for that specific region. And we have had great help from Business Sweden, both in Singapore, but also in Australia, both during the market analysis, but also during the implementation of the system in Singapore. So we are using Business Sweden on a weekly basis in our support there. That's all, and hopefully you can follow the link on the presentation if you want to see the video from the Singapore installation. Thanks.
Thank you very much, Radar, for that presentation. And again, this presentation will be shared with the group, so with the audience. So if you want to see the video afterwards, you can do that. All right, so I will hand over to our last speaker for the day, Don Credassi, General Manager Australia for DNV Imatis. So
you have to give me control. I can't see the control anymore.
Let me. Does this work for you now?
There we go.
Does it work for you, Don?
I'm finding our slides. Where do we start? 80s, 90s? Right.
So I'm on slide 7. Yeah, okay, great. So thank you, Don. I'll give you 10 minutes to go through your presentation.
Good, okay. My name is Dan Credassi. I'm here representing DNV Imatis. Thank you for the time. I am here in Sydney, Australia, where I've lived for 22 years. Although I moved here from New York, so I know how to speak fast, I will continue. We were recently acquired by DNV of Norway. The amalgamation is underway. This is our vision and DNV's vision, which resonates. We're a small, medium enterprise, just over 65 people, with installations of our software in 58 digital hospitals across 7 countries. Today, we'll take you across our experience in Australia and our early experiences in opening our new office in Singapore. Our software is an integration platform which connects all the disparate systems you find in today's modern hospitals, RTLS systems, robotic machines that deliver laundry, meds, the lifts, the blinds, the power, security systems, nurse call, including the clinical systems of record such as EMR, PAS, and such. So we connect all of these and create a single pane of glass for anyone in the patient pathway in a modern digital hospital. We transition from the left side really to the digital on the right side. That's what we help our clients do. The single pane of glass appears regardless of your position, if you're clinical, allied health, patient, carer, family member, or facility worker, such as a cleaner, porter, orderly. We have portals that are role-based that contain all the information based on all the integrations you need to do your job. And these portals can appear anywhere in the modern digital hospital. This is a representation of some of our most famous anchor clients. That you'll see Australia here, the Royal Adelaide Hospital, and I'll tell you the story about how that hospital came to be our largest client in this market. In 2009, when the specification was written for this hospital, it was based on St. Olav's Hospital. And it just so happens, 5 years prior, our software was installed across the St. Olav's, doing the same thing, an integration platform with portals for clinicians. Subsequent to that, our software now manages all the outpatient flow, as well as all the inpatient messaging, alarms, and system integrations for the entire campus. Here are some photos of the actual facility, the robots, the waiting areas, and such. Some of those panes of glass that I mentioned based on the role at the time. Here's a ward management board. And here are some kiosks, which post-COVID are no longer a good idea. We're migrating to mobile check-in in a few months. So, greenfield hospitals versus brownfield hospitals. Brownfield being existing hospitals which are renovating or undergoing expansion, and greenfield hospitals which are brand new. Here's a listing of the most the high value concept stage new hospitals underway in Australia. For us, this is ripe target market. The next stage of development is the design and development, where you actually hire architects and building consultants and such, and start to get the approvals made to begin the construction. This is also ripe, but perhaps for different digital solutions. As far as our advice, here is a screen capture. I won't read through them all because they're self-evident. I'll be on the panel later if anyone has a question. We have yet to establish a client, a paying client in Singapore. Innovation Norway, through their health tech program, has introduced us to many potential clients, and introduced us also, they got us into an invitation-only tender. So although we did not win that tender, what we did learn is captured here in this slide to make available to you. So I think I've raced through the presentation except for these two last points, that our Innovation Norway did generate qualified leads, especially in Singapore, and it de-risks our sales pitch when someone from the embassy or Business Scandinavia calls on behalf of Amatis in a new market. This de-risks that first contact, and it's very beneficial for a small company like us. Thank you.
Thank you, Don. That was a lot quicker than 10 minutes, I think. So clearly, people in New York speak very fast. Thanks, everyone, for very interesting presentations about your companies, your solutions, and some of your success cases in Asia Pacific, but also learnings and challenges. So we have a couple of minutes left of the webinar to do a Nordic showcase panel with our speakers to pose a few questions. So if anyone from the audience have specific questions to our presenters today, please post them in the chat function and I will throw them at the panel. But I also have myself a couple of questions to our speakers. So I will start here and then I'll see if we have more questions coming in from the chat function. So after listening in to all of you guys' stories and also from the market research study that we have conducted for this market, I think it's clear to everyone that when you look at medtech, the medtech industry, Europe and the US are popular markets for medtech companies to target in their internationalization journey. So want to pose the questions to our speakers on, how did you make the decision to actually enter or target the Asia Pacific region, and what advantages have you seen from entering this region? So maybe Radar, you want to start on this one?
Yes, I can start. And the different countries we are working with, I mean, it's a benefit if they have the same targets of cost effectiveness, that they have an elderly population, they want to do more of remote care, and also that they have the infrastructure for the ambulance care, that they have also IT knowledge, they have dispatch systems, they have modern technology, because then our solutions really make the benefit. So that's why we see the same barriers or the same challenges for our customers driving efficiency healthcare, and we saw that in Singapore, we see that in Australia. And a quick comparison is, for example, US market, where we have different clinical performance indicators. So they have a different target of driving efficiency. So there the ambulance care is not of interest for us. Yeah. Yep.
Thank you. And we actually have a question from the audience to you, Radar. So let me take this as a follow-up. So a question here is, how did you apply for reimbursement listing at funding organizations in Australia or New Zealand?
Reimbursement is not a question for our solutions, because I mean, all our products are sold through a procurement. So it's actually the ambulance services that procure, or the primary care centers, they procure the solutions, and then we are entering a framework agreement. So we're not covered by reimbursement, and that's not an issue for us.
Yeah, understand. Thank you. All right, so yeah, in terms of then making the decision to prioritize Asia Pacific in your internationalization, Park, any comments from you here from Murdoch perspective?
Yes, as I briefly mentioned in the beginning of my presentation, that our business has been kind of successful in the US and Europe, and the growth in terms of the growth rate has been quite stabilized. While we do see a lot of potential and double-digit growth potential for the next 10-20 years in this region. So we definitely moved our focus into the Asia Pacific, especially that we knew that that will be the next, driving a business cases from the region. So that was one of the main, reasons that we decided to get into this market. And plus, those countries that already your study also showed that they are also willing to, invest and they are also willing to learn from other advanced countries, especially in their healthcare, structure and infrastructure and the system. So it is also kind of a win-win type of situation, so that we can also share our success cases and best practices with those countries. So I think it's kind of met the needs on both sides.
Yeah, thank you for that. Very interesting to hear. So there's a lot of opportunities. There's a lot of good business to be made in Asia Pacific. But as we also have talked about in this webinar, is that there are challenges to think about when entering this region or growing in this region. So it would be interesting to hear from our speakers some of the main challenges that you have experienced entering or doing business in this region. So would be interesting to have some perspective from iCare and you, Shane, having a medical device product and doing business here.
Thanks, Ida. Yeah, every country is very different, and that's part of the challenge, whether it's a language, a culture, regulatory process, whether it's a private hospital system, whether it's a public system, whether it's a public tender that you have to apply for. There's so many different challenges that in each and every country. But also in saying that, though, Park mentioned too before about having a good distribution partner and a clear understanding of each market that you're actually going into. You really need to ensure that you have a go-to-market fit in every country for each and every product. And, we have a range of products in our basket, but it doesn't necessarily mean that we sell every product in every country, because it may just not fit the market need. So, I guess really the take-home message is understand the regulatory process, find some good distribution partners, ensure that you have good market fit, and also too, take your time. You need to build your brand awareness and confidence within each and every market. And if you try and rush or have high expectations that you're going to go from 0 to 100 million, you may fall short. So always good to take your time and get to know each and every market.
Thank you for that, Shane. Good and interesting perspectives. Dawn from Imatis, would be good to hear from your perspective, and specifically on the Australian market, which is a market that comes up as a very high potential market for a lot of medtech companies. How it is there in terms of challenges having a digital health solution product?
Right. As confirmed by Nicholas in some of the portion of the readout in your report, the digital solutions here in Australia are purchased in a federated manner. Really, states are broken up into local health districts, municipal districts, if you will, but they can be quite vast, covering regional areas. And these local health districts have the budget and really the mandate to purchase the digital solutions that work best for their local health district. So it's quite federated. Whereas we've discovered in Singapore, solutions, say a pilot that works well in one public hospital can readily propagate across other hospitals in the group and across the entire country if they work well. So propagation of digital solutions is more difficult in Australia because the procurement is done in islands, where in Singapore it's more holistic.
All right. So let's talk a little bit about main problem statement facing these countries. So what you heard from our sharing previously in the study, we've been trying to map out some of the key problem statements that we see in the healthcare industries in these markets. So also something that would be interesting from our speakers' point of view in terms of what you have observed in the markets where you're present and how you see that your solution is actually helping to solve some of these main challenges. So I'll give the word to Radar from Orthovis to share about Singapore here.
Yeah, so the main challenge for our customer is driving efficiency with their ambulance fleet. And I can take an example in one of our customers in UK, South Central, which is covering 5 million people. I mean, they have used our systems for 6 years now, or 7, and they have increased the number of calls with 30% during that period of time, but still with the same staff and vehicles. And it's actually by usually before you reach an end, you cannot drive faster, and it's not about driving faster with the vehicles. It's about being smart, and they have reduced the number of patients they actually transport to the hospital. So by doing much more advanced care on site, but also with all the data that you collect, you can do really analysis. So you know exactly where will the traffic accidents be. So then you place the vehicles based on the right day, the right hour in different places, and also for the crew. So it's with all that data you collect, you can actually optimize your business in a much smarter way, which was with paper and pen. It's just impossible to do that analysis. So driving efficiency with the system, that's really the key factor. And that's also why Singapore, they realized they have to do this in a different way. And that's why they started to go out in a procurement for a digital system. Yeah.
Thank you for that sharing about Singapore. Any other input here from the rest of the team? Shane, Park, Dan, any more comments from you guys? Last comments before we go to closing remarks. We have a few minutes left.
Sure. I guess, from our side of things, the healthcare ecosystem is very different in every country, and where people are up to and that evolution is very challenging. Chronic disease is a major issue right across Asia Pac, and diabetes is a huge challenge for every country. Where they need to get ahead is to actually start to realise that and actually start to implement changes into their system. It's not easy for them to do that, whether it's the lack of money in the health insurance systems to do that, the patient education is to understand they need to take ownership of these things. These are all of the challenges, and I think any company that's in that chronic disease space, education becomes a massive part of the growth of their business. Not just the healthcare providers, but the general public, and understanding that they need to take ownership themselves as well to have a happy life. Thanks.
Thank you for those closing words, Shane. All right, we have reached the hour soon of this webinar, and I would give the word now to Paul to round off. I just want to say that thank you for everyone that has been listening in. Thank you to all our speakers for your kind sharing. And during the closing remarks that Paul will talk about, I would also like to encourage anyone who is still on the line to drop a note in the chat function about your LinkedIn profile if you want to share and connect with peers in this group. So also feel free to do that. Thank you for me today, and final words to you, Paul.
Thank you very much, Ida, and thank you very much also to the panelists and presenters for the very interesting sharing session. We are coming towards the end of our event today, but before we do so, there are a couple of issues that we would like to highlight regarding next steps. Before the sharing session with the companies, we asked you a couple of poll questions. I think it would be useful to revisit these, what you replied, as it will be part of the feedback determining the next steps. So maybe if you could put that up, Ida, I think you have it at your end.
Yes, you should be able to see it now.
Yep. So the first question was directed at the value of a joint Nordic collaboration as opposed to unilateral initiatives. More than 60% rated this as a high value. Slightly more than 20% rated it as highly valuable. The next question looked at the kind of support needed. More than 25% of you mentioned access to partners and distributors, whereas more than 20% rated access to customers and sales support. And finally, around 17% pointed towards market research and information. And the final question looked at the markets of interest, and approximately 34% mentioned Southeast Asia, 28% mentioned East Asia, and whereas 25% mentioned Oceania. Now, speaking of next steps, in our report, we have mapped the opportunities in 7 key markets in the larger Asia-Pacific region. And the next steps will be to mobilize companies, basically you, those of you that will be interested in joining us, to take these opportunities. How we do so, however, is something that we would like to discuss with you. And for this reason, we will organize smaller workshops over the next couple of weeks to get your input on this. So Business Sweden will contact Swedish companies, we will contact the Norwegian companies, and Business Finland will contact the Finnish companies. But we do have a couple of initial suggestions based on our internal discussion, and I'll just put up a couple of slides on this very rapidly. So one of the things that we have looked at, as Nicholas and Ida mentioned, we have segmented the markets into 3 groups depending on maturity. And we could organize market entry programs where we target one segment at a time. For instance, this could include a visit to Singapore and Australia, where we set up meetings with relevant customers, partners and distributors, etc., like you do in a typical market entry program. Another market entry program would target Thailand and Malaysia, and so on. Another option would be to set up a regional business network for Nordic health tech companies that meet on a regular basis. And this is something that we have done within energy, for instance. That is a Norwegian initiative only, because there are quite a few Norwegian energy companies here. So we've just established that. The whole idea of that is that we meet on a regular basis, could be on a bi-monthly, it could be on a quarterly basis. We share updated market info with the companies, and it's also an opportunity for the companies to share project activities, project opportunities, and so on. So that is another possible follow-up. So that's just something that I wanted to mention towards the end, and I think we're pretty much on overtime. But as I said, we will contact the companies that have participated here and initiate discussions with you on next steps. And that's the last word for me, at least. Ida, maybe you want to say something towards the end as well.
No, I just want to say thanks, and I'm quite happy to see the results from the poll that clearly the companies on this call at least see a value of doing a joint positioning, and I think that it's clear what markets are the most relevant, and also what type of support we can do, so then we know how to focus our efforts and resources. So just, yeah, big thank you to everyone. This has been a pleasure.
Absolutely.
Thanks, Ida.
Bye.
Thank you, everyone.
Thanks everyone.
Have a great day, evening.